Hello, my name is Dr. Douglas Leventhal. I'm one of the otolaryngologists and facial plastic surgeons at ENT and Allergy Associates in Oradell, New Jersey. I see a lot of patients in the office that complain of difficulty breathing through their nose that sometimes is secondary to nasal valve collapse. So it sounds like a horrible problem, however, it's easily correctable. So if you're one of those patients that has a hard time breathing through your nose, I suggest that you listen and watch and learn about how you may be able to get the relief that you deserve. Nasal obstruction is an extremely common complaint seen by many otolaryngologists. Nasal valve collapse is an often overlooked cause of nasal obstruction that's readily treatable and can lead to a significant improvement in quality of life. There are two types of nasal valves. The external nasal valve, which shown here, is at the opening of the nostril, and the internal nasal valve, which seen here in green, is a little further inside the nose. If the nasal valve is narrowed or there's lack of sufficient strength of the lateral nasal wall, collapse of the nasal airway can occur. So here you see the normal anatomy of the nose. You have the alar or lower lateral cartilages, and then you have the upper lateral cartilages in the middle, and then the nasal bones up top. Some people are born with a configuration of cartilages such that there's weakness in the outer part of the wall and it collapses with the negative pressure that it takes to inhale through your nose. Also, people as they age have nasal cartilages that weaken and can also lead to nasal valve collapse. Finally, patients that have undergone surgery before, especially rhinoplasty, can have their nose narrowed too much where it can cause nasal valve collapse. So diagnosis of nasal valve collapse is based upon a thorough physical examination. Inspection of the external nose, usually from the underside, at rest and with inspiration, often clues physicians into the diagnosis. Here you can see a gentleman with severe collapse of his right nostril when he breathes in. The top picture is at rest, and the bottom picture, where you can see the significant collapse on the right side, is when he tries to take a breath in through his nose. In this next photo, this is another patient of mine who came in complaining of not being able to breathe, especially when she exercised. You can see in the top photo here, this is her at rest, and in the bottom photo, this is when she tries to take a deep breath in through her nose. You can see both nostrils are completely collapsed. To see if you have nasal collapse, you can try and do what's called the Cottle maneuver at home. Although this is a non-specific test, if your breathing is improved when you push out your cheeks, like the photo shown here, then you may have nasal valve collapse. Treatment of nasal valve collapse consists of mechanical dilators, which offer temporary relief. Devices shown here, such as breathe right strips, may be used by patients to provide relief at night. However, they're obviously not feasible for daytime use, unless of course you are Jerry Rice as shown here and you're a football player for a living. Surgery to correct nasal valve collapse is usually the best long-term option. It's done as an outpatient procedure and there are usually no visible external scars. Patients typically notice an immediate dramatic improvement in their nasal breathing. The procedure is usually done in conjunction with straightening of a deviated septum. The cartilage that is removed from the nasal septum during the septoplasty is then repositioned to support either the upper lateral cartilages, the lower lateral cartilages, or the nostril rims, as shown here. Here you can see a patient who I fixed a left nasal valve collapse. You can see on the left side beforehand, when he took a breath in, the left side of his nose collapsed. On the right side, after adding a cartilage graft, he has more strength and he's able to get more air through the left side of his nostril. This is the same young lady I showed you earlier. Here on the left side you can see at rest and her severe collapse. Actually, she had a prior surgery before seeing me where somebody fixed her deviated septum and didn't realize that the nasal valve collapse was her biggest issue, and she still had trouble breathing after the first surgery. On the right side you can see here, after we corrected her nasal valve collapse, the bottom right hand picture shows that her nostrils now remain patent when she tries to take a deep breath in. So in conclusion, if you have a difficult time breathing through your nose, I recommend seeing an otolaryngologist that is familiar with diagnosing and treating nasal valve collapse, as the correction of this affords patients the wonderful ability to breathe through their nose.